Happy Wednesday, everyone. How are you this evening? My name is Shamika Rhymes, and this is Soulibration. Let me know in the chat where you guys are watching from. Let me know how you're doing, and if you had to deal with any of that crazy snowstorm yesterday. I know we got some snow here in North Carolina. And also remember to share this with your network. And if you have any questions at all during the show, make sure you drop it in the chat. And before we dive into tonight's show, because I know you saw the thumbnail, so you know what we're talking about. But before we dive in, I want to ask you all, have you ever considered how your spine and nervous system might affect your overall health? Have you ever been to a chiropractor before? Let me know that in the chat. I'd love to hear exactly your thoughts, your experiences, and I'll share those throughout the show as well. So let me tell you a little bit about what we're going to be talking about tonight. We're going to be talking about chiropractic care. It's often misunderstood as just a solution for back pain, but it can also promote overall wellness. And so we're going to take a look at how aligning your spine can improve your nervous system function, alleviate chronic conditions, and enhance your quality of life. And my favorite part is it can help with sleep. So I see we have Charlotte, North Carolina in the building checking in. Gastonia, welcome, welcome. And let me introduce you guys to my guest. Tonight I have Dr. Amber Jackson, and she's a passionate chiropractor dedicated to providing exceptional care to her patients. And she's got an amazing background. She's got a background in fashion and retail management, which I absolutely love. But I can't wait for her to share her journey to this wellness, going from, that to health. So anyway, she holds a Doctor of Chiropractic degree from Life University, and she's a well-respected public speaker, and she works at Life University as a senior clinical research liaison. And she's got like a huge resume. She's also a member of the Georgia Chiropractic Association, and she's the executive producer and host of the GCA's podcast, The Chiropractic Connection. And I see Atlanta checking in. Let's bring Dr. Jackson on.
Hello.
Hi, Dr. Jackson. How are you?
Good evening. I'm great. Thank you so much for having me.
Well, I feel like I've been stalking you on social media for a while, so I'm so glad that we could finally connect.
Absolutely. Absolutely. I love how we connected. I'm glad that we finally get a chance to have this conversation. It's a much needed one. So thank you so much for having me. I'm excited to get into it.
Absolutely. So guys, just like I was saying, we have to start off with what inspired you to follow this career path?
Well, actually, it's a pretty long and windy road. So I knew at a young age that I wanted to be in healthcare. I played sports when I was in high school. And so I knew that I was going to do like some type of sports medicine.
Mm-hmm.
My goal was to do orthopedic surgery. And I was like, yeah, I love that. I love surgery. That's going to be great. And I was a student athlete. So I had visited them a ton.
Yeah.
Early on in my career, I sustained a couple different injuries from a foot to a knee. And then when I played volleyball, so I played at Alabama State my freshman year, and I had just developed really bad form as I was playing. And ultimately, it started with just having a little bit of low back pain. And then it accumulated to the point where at 18 years old, I felt like I could barely walk. So I was having trouble going to practice, and that ended my career. Now, it's funny, I tell my students, because I'm also an adjunct professor, knowing now, if I knew then what I know now, I'm so pissed that I gave up my volleyball career, because it could have been prevented.
Mm-hmm.
I had a hot low back or acute back injury. I had swollen disc. I had a couple of disc herniations in my low back. And that was really all because of how I was playing volleyball. I just wasn't taught proper form. I didn't have the right function. So it accumulated. So with that being said, I figured, well, how am I going to become an orthopedic surgeon? I can barely stand in an OR. I'm not going to be able to stand for, 3 hours, let alone 8 hours. And so I kind of gave up the idea of going into healthcare totally. I felt like I didn't want to become something that couldn't fix me. And I was like, well, I'm not finding that answer. So that is how I ended up in fashion. My mom came back from a trip overseas, and she's like, you need to do something. So she convinced me to go back to school and change careers because I wanted to study abroad and I wanted to go to Paris. And that is how I ended up in the fashion world. And I did that for about 10 years. And it was great, but it wasn't fulfilling. It didn't satisfy my soul. You can only sell so many Chanel bags and style so many people. And then after a while, you're yeah, this is just not like, I can't really leave a legacy with this.
Hmm.
So I did some soul searching. I took a couple steps back in my career. My, administration and the corporate team thought I was probably crazy because I was making really good money. And I was like, this is just not for me anymore. I just was unhappy. So I did some soul searching. I went to not only my church, but everybody else's church, like mosques, temples, synagogues, prayed, read. Like, sometimes you just got to go in the forest and like figure out what God has for you. And I remember I woke up
Yeah.
a with a very clear vision. I had a dream, and in my dream, I was a chiropractor. Don't know why. I was a
Wow.
chiropractor. I was practicing. I could smell the clinic. My son was practicing alongside me. At the time, I only have one. I had one. Now I have two. So I don't know who that will be. I always throw the hints to them, my kids. And I just kind of knew when I woke up from that dream that that was for me, right? Alongside that, I had recently had been in a car accident, and so I had started getting care again through the allopathic healthcare system and not getting well. Finally, someone said, "Why don't you go see a chiropractor?" I had never considered it. I don't know why at all, and I went and we started treatments, and it was life changing for me. It had been 12 or 13 years since I had injured myself, and I still had this back pain. I was just managing it every single day, but it got to the point, Shamika, I couldn't even like push a vacuum cleaner without being
Wow.
uncomfortable. And after about 4 weeks of being in care, I was like, oh my God, this is it. So I think all of that subliminally, I dreamt about it, and I woke up and I was like, how do I give this to people for the rest of my life? This is something I
Yeah.
leave a legacy on. So I'm extremely passionate about it because, I'm not only a member, I mean, I'm a client too, it changed my life. So, and I
Yeah.
quit my job and I was like, I'm going back to school. Everybody's like, what? I'm like, yeah, I'm going back to school. Bye.
I
and
love that.
yeah, so that, it's the thing that I love to do. So yeah.
Wow. So for those that may, because people already have their idea in their head of what a chiropractor does. Can you just kind of give an overview of what it is you do? Because I think sometimes when you hear it, you're just automatically like, oh, cracking bones, like
Right. Right.
can you explain what it is that you actually do?
Yeah. So when I see patients and they come in, I mean, I've worked in a couple different environments, a couple different type of clinics. So they're all a little different. For me personally, I want to be the doctor for my patients that they are not receiving in other areas of healthcare.
Mhm.
What we look at is the body as a whole, as one unit. So we don't segment it. We don't look at, oh, like and again, I'm going to talk a lot about the difference between allopathic and holistic healthcare, but I
Mhm.
don't want to negate the fact that we need them as well. They do a great job at what they do. And I
Mhm.
want to say that we should be co-managing patients alongside of them and not separate from them. Our patients do better when we work together. So with
Mhm.
that being said, we don't segment the body. We look at the body as one unit. Considering that the brain and the spine and the spinal cord are the mastery control centers for the body, that's what our focus is. We get labeled as back doctors, but what we really are nervous system doctors.
Mhm.
Our job is to clear the nervous system, remove interferences so that the body can properly function and it can do the things that it needs to do. Now, that is going to look different in every office with every
Mhm.
patient because we all have different things that we walk into our offices with. And that artistry of chiropractic can vary. But again, at the root cause of all of that, what we are nervous system doctors. Our job is to locate any interferences that we find within the nervous system, address them, and clear them. And then we walk away and we let the body do the work, right? So it is a team effort. It is not me as Dr. Jackson being the one that facilitates the healing. My
Mhm.
goal is to remove the interference so that you, Shamika, you can heal better, right? That you can
Yeah.
walk away and continue to heal post visit while you're at home and things like that. So that's really what our focus is. And how we do that can vary from practice to practice.
Mhm. Yeah, I was telling you earlier, I go to a chiropractor and I have been going probably, I think, since July, actually. And
Okay.
it's funny when you were talking about your injuries. I remember back in 2013 when I could barely walk, people kept saying, go to a chiropractor. And I was like, nope. Mm-mm. But fast forward to now, it's like I could have avoided a lot of things had I gone
Mhm.
way back then. And to hear now, like, oh, now your posture's straight, this your pelvis is straight in the right place, and all these things. I'm like, I could have been walking
Right.
like a
Right.
normal person.
Exactly.
But yeah,
Exactly.
but it's yeah. So can you explain a little bit? And I see some more people checking in. Let me shout out them real quick. Jacksonville, Asheville, another Charlotte. They're in the chat. Let us know if you have questions, everyone. How does spinal alignment influence overall health and well-being? Because does that? Because I know you said something about you were talking about the overall nervous system, but the spine being aligned, does that play a huge part as well?
Absolutely. So when we think about the brain, I know we've all had a form of biology class. So we'll just keep it really simple. This is what I tell my middle school kids and younger. So when we think about the brain being the mastery control center, right? From that stems the brainstem, and down that is the spinal cord. Every nerve for every single part of our body, from our hair to our nails, our skin, and our organs, and everything in between, tissue, blood, all of that has to be innervated by nerves. The nerves flow from the spinal cord. The only thing that is wrapped around the spinal cord is the spine. Now, it has two jobs: to protect the spinal cord, right? To make sure that those nerves can function and flow properly, and to
Mhm.
kind of hold on to our appendicular skeleton, right? So our appendages, our arms and our legs anchor to our spine. But if you've
Mhm.
got misalignments within the spine, you are going to have some nervous system interference. God designed us so perfectly there that there's just enough space for blood vessels and tissues and nerves to flow through these small little openings outside of our that are alongside of our spine. So when our spine tweaks or turns just ever so, it's not bad. It's not like it's
Mhm.
like and you're totally, unless you have a scoliosis.
Right.
But from day to day, we have these little micro traumas that sometimes turn our vertebral bodies just enough, where it puts just enough pressure on one of those nerves, and you may feel it or you may not. And most
Mhm.
people, they tend to feel it, right? So it depends on what's going on with them. And it could be everything from they can't sleep well to digestive issues. It could show up in chronic issues, and or it could just be something that's acute. So making sure that the spine is properly aligned and nothing is impinged or pinched or interfered. When we talk about a pinched nerve, that's what we're
Mhm.
talking, right? So the vertebral body has turned and it's pinching that nerve. Our job is to take the pressure off of that nerve. And so we want to make sure that everything is lined up as perfectly as it can be based on your health, right?
Mhm.
So if we can get you young, we want to get you young.
Mhm.
If we can't get you to your 75, then we start there. And that's where we go from. There's limitations to what's possible, but the better that we can keep that spine in alignment, the better your nervous system is going to function. And overall, you're going to have better optimal function within your body based off of that. So, yeah.
Okay. So, beyond back pain, what other conditions or symptoms can chiropractic care help address? I was telling you about last night. I went to the chiropractor, and y'all, I told her I can't sleep. Or I'm having issues staying asleep. She did something in my neck, and when I literally by the time I walked from the table to the front desk, I was so sleepy that I
Yeah.
came home and got straight in the bed.
Yeah.
Went
So
to sleep.
sounds like what she did is she turned off your fight or flight system, which is your
Yep.
sympathetic system, and activated your rest and digest system, right? So
Mhm.
what happens a lot of times is our patients, they walk in with, I have this neck pain, back pain, hip pain, or something like that. But they come with all of their other things, right? So they don't think that we are going to ask those questions. And that's part of our overall assessment. We want to know, how are you sleeping? What's your diet like? Are there things that you like to do that you've been unable to do?
Mm-hmm.
Are you taking any medication? So we do a very thorough history with each patient, because oftentimes, while we're not necessarily looking to address one specific cause, again, our goal is just to clear the nervous system. We let the body do the work after that. But what we do find is we can help patients who have, let's say they have irritable bowel syndrome, or they have digestive issues. We do our analysis, and we find, well, interesting. The area that controls your digestive system has some misalignments, has some subluxations. There are areas where you need to be adjusted. We need to realign this. And after we do that, it clears, and now everything flows
Yeah.
properly, right? It's about brain body connection. So we see all types of things. I have patients who have, they started seeing me because they had neck pain, but when we got to the root cause of it, they were really having migraines or chronic headaches. And now we track those headaches, and they don't have headaches. I don't chase the headache, but I check on the headache every time they come in. And a lot of times patients are like, I don't have it anymore. It's gone. It's funny when I see patients who they had a thing for a long time, and then we check in at like 6 weeks, and they're like, yeah, I don't have that thing anymore. I totally forgot about it. That's the best news that I could ever hear.
Yeah.
Sleep deprivation or not sleeping well could be one of those things as well. Even down to bladder function, numbness and tingling in the legs. There's a list of things that we tend to affect, not necessarily directly. We don't, again, go after that. I would never have a patient that came in and said, hey, I'm having difficulty urinating, and I'm specifically looking at that. Again, I look at the body as a whole. So if I clear that and it goes with it, perfect. That's what I'm intending for it to happen. And that's the beautiful thing about chiropractic care, is because we address everything as a one unit, other things tend to subside once we clear the entire system. So it's beautiful. It's really nice. I tell my students all the time, your patients are going to walk in with all of their issues, and you'd be amazed at how you can change something for them that they've had or they've been living with all their life. So it can
Yeah.
range. Mm-hmm.
I see we got some questions in the chat. Robert Brooks II wants to know, can chiropractic care help children with seizures?
It's interesting. So I know that there are studies that are being done on that. I had a colleague who, she was in school with me, and she had chronic seizures. She had epilepsy seizures. She had fallen and hit her head and started having seizures later in life. While she was in school and started getting care, every time she would seize. Now, if she was with one of us, obviously we could not adjust her, but I was at seminars with her, and she would have a seizure and she would get adjusted, and it would reduce the time or the frequency. I don't know where she's at now, and I don't want to say, yes, chiropractic care can definitely fix a seizure or stop it, but I have seen firsthand where it has slowed down the frequency of seizures depending on how often they get adjusted. So it's one of those things. It depends on what's causing the seizure, where it's coming from, but I always say it doesn't hurt to ask, or to at least visit a doctor, a chiropractor, and have them take a look at it. I've had patients who have come in and they're epileptic, and they're like, I haven't had a seizure in months. So again, I don't chase the seizure, but it's one of those things that tends to subside just because we're clearing the nervous system. So it's hard to say. I don't want to give a definitive yes to that, but I always say in those kind of cases, it's worth going to ask and visiting a chiropractor to see what they can do about it, for sure.
Okay. I had a couple questions that people texted me, so I'm going to read those too. One is from my dad, Tommy Rhymes. He wants to know if chiropractic care can help neuropathy, like if you have neuropathy in your hands or feet.
So it depends on if it's like what's causing it, right? So if we're talking about a blood flow situation, then yeah, we can definitely work on that. If it's diabetic, that could be a little bit trickier, because obviously it depends on what type of diabetes that person has. So the neuropathy, it's a two-part question. It's not a simple answer. But yes, so I've had patients who've had some numbness and tingling or poor circulation in their limbs, and we start working on things. Because again, we don't just adjust in the spine. We can adjust any joint. I have had patients that have had tingling in their legs and calves and numbness in their feet, and had neuropathy like symptoms. we've done ankle adjustment and a knee adjustment a couple weeks in a row. And after that, they're like, yeah, it's gone. I'm like, okay,
Mhm.
great, perfect. And we move on, and we clear the other things.
Mhm.
So yes, can it help? Absolutely. Does it depend on the cause? For sure. It's hard to say. There's limitations to matter. So once something has been damaged, we cannot restore. We can't put back what's been lost. But
Mhm.
can we stop or slow down the progression of something? Absolutely. We can definitely help with that.
Okay. And then let's see, I have a question from Carrie Graham, Dr. Carrie Graham. She wants to know about potential dangers of chiropractic manipulation. Is there the chance that, let me rephrase, is there a chance of doing more harm than good?
So that's again a patient by patient, right?
Okay.
The importance of doing a extremely thorough assessment on a patient. I had a patient who came in. I'll give you an example. Um, he's a I take care of their entire family. I told them that I will name a wing in my office after them because I now see them. He came in and his party trick was he liked to tilt his head back and it would make him go dizzy. Want to see my party trick? No, I don't want to see,
Oh, go
don't
ahead.
a party trick. So we did a full assessment and I just was not comfortable doing any manipulations in his neck.
Mhm.
I had a feeling that there was some vertebral artery insufficiency. So we have arteries that feed our brain and our face and our head.
Mhm.
And every time he did that, he was cutting off the blood flow, which is why he got dizzy and would get a little woozy. I am not putting my license on the line or my
Mhm.
ego to adjust that. Could
Yeah.
I adjust him physically? Sure. Would I? Heck no. I would
Mhm.
never do that. And that is the difference between just doing anything and being sure that you are taking care of the patient and doing no harm, right? And that is what we should be doing with each patient. Not every patient is a candidate for chiropractic care. We have more patients that are that than aren't, but in his case, he we could address things below, but I would never manipulate his neck and never have. Subsequently, I sent him to see his primary care physician, who he hadn't seen in years, and he was on the verge of having a heart attack.
Oh,
So
goodness.
he hadn't been in years. He came back and he's like, "You scared me so bad. I went to see my doctor, and he's had a triple bypass since then." Had he not shown me his party trick and I had done a thorough assessment and I had been negligent and
Mhm.
just decided to, I'm going to just adjust his neck, yeah, I could have hurt him very badly. And so it is very important that we take our time and we assess our patients. Are there bad doctors out there? Of course. In
Mhm.
every field, there are. In every scope of profession, there are good and bad people on both sides of it. But it's our job to make sure that we're doing a thorough assessment. If you are a patient who's like concerned about whether your chronic issue would not be a candidate for chiropractic care, you have a right to say no. I always tell my patients they're in control. So if we're doing something
Mhm.
you're not comfortable with, then say no. I don't
Yeah.
like that. There are other things that we can do. We do not have to do a rotatory adjustment, which is basically bringing the neck to extension and turning it. We don't have
Mhm.
to. There's other methods of being able to adjust without that that still can clear the nervous system. So there are options, and it
Mhm.
is case by case. Are there contraindications for chiropractic care? Absolutely. That's why the first visit should be an extremely thorough assessment.
Okay.
Yeah.
Now, are there specific benefits for pregnant women, athletes, or children if they, because I've gone into the chiropractic office and I've seen both pregnant women and children, even babies in there. So, what are
Yeah.
the benefits for them?
So they all have something different. Let's start with the athletes. They're the easiest. So an
Mhm.
athlete's job when they're on the field, they want to perform at their most optimal potential, right? They want muscles firing fast. They want a quick turnover. They want to be able to do their sport very well. So
Mhm.
we have some areas where there's nervous system and the brain's not getting that brain body connection, firing back. So the
Mhm.
brain has to talk to the body and the body needs to tell the brain what it needs. And they need to have a fluid conversation. When you're an athlete, you need to have quick reaction time. If you don't have that quick reaction time, then you're going to lag a little bit. So I have a kid who I see all the time. He's a football player, and he comes in before games, sometimes after, depending on his injury or if he didn't get injured. And we focus on those things. I may work on extremities, and I may do knee, hip, ankle. to get him moving a little bit better, because I want him functioning very well, so that he can get out to form, do his sport and do it at a high level. So athletes can benefit from it extremely well. Hence the reason that every major sports team, NFL, NBA, hockey, and MLB, they all have a chiropractor on staff. They're on the sideline. They have been for years. And so it's funny because I don't know if he still is, but our head of the Olympic committee for the doctors, he was a chiropractor. I think he might still be there, but don't quote me on that. But for many years, it was a chiropractor that was in charge of all of the doctors that were part of the Olympic committee. And if you watch the Olympics, you remember that they had a chiropractor for every single country at the last Olympics. So that's a huge testament to how well we can affect athletes. Now, the babies. I love the babies. So my oldest is 12. So his first adjustment was 4. My youngest is 4, and his first adjustment was 2 days old. It was, yeah. Birth is trauma. We think of it as a beautiful, glorious, experience, and it can be, but it is trauma to baby. Baby is coming through that canal, and the method is a turn and a pull back, a turn and a pull back, and they come head first. So what is turning and what is being pulled back? Their neck. So when we have babies that come out and they have difficulty latching, or they're colicky, or they're not sleeping well, if we can go in and clear their nervous system day 1, 2, 3, 4, 5, or the earlier the better. The better baby is, the happier mom is. A lot of times we find that latching issues have nothing to do with mom, nothing necessarily to do with baby, unless they have like a cleft palate or something, and everything to do with the fact that baby can't turn his or her head to the side to latch and comfortable latching on one side, or they have a bad latch. So we clear some of those things. I see those a lot. I have a lot of colleagues who are prenatal or perinatal. They work with peds and pregnant moms and babies, and it's really amazing to see. I love watching babies get adjusted. The ones that are colicky stop crying. The ones that have constipation start pooping. The ones who don't sleep fall asleep. And they do it within a few minutes after their adjustment. Babies get light force adjustments. We use sustained contact. We do not do paya. There's no cracks or pops. They're still cartilaginous. And so we're not dropping on babies. We're using a lot of times just our pinkies or our ring fingers, and doing a sustained contact to different areas of their body. And it's really at the same pressure that you would use to check a tomato at the store. You check that tomato and it pushes in, or an avocado, you push into, that's harder than the adjustment that we would do on a child. Babies are really fun to adjust, and they respond so innately, so beautifully. And a lot of times they wiggle into the adjustment, and it is really blissful to see them recover from that. My children and a lot of my friends have brought their babies to chiropractors when they had ear infections. We often hear that it's the eustachian tubes, or ear canal, that's causing the ear infection, when really what we have learned is it's the first bone that's a little imbalanced. And so the ear canal doesn't drain on one.
Wow.
And so getting that little micro adjustment on them allows their ears to balance. And so now their ear eustachian tubes can drain, and it stops the ear infections. There are a lot of little things like that, and I highly suggest if people have questions to seek out a prenatal or pediatric chiropractor. They're so gentle and they're so loving, and you will sleep so much better. As far as pregnant moms, yes, absolutely. So pregnancy is really hard on the body, right? We have a lot of bones that are moving around. Our move, our pelvis has to open up. It's very hard on the body. Our round ligament stretches from being this to all the way this. So you connect the uterus to the pelvis. And so chiropractic care is great for that. The one thing that we kind of are a little bit mindful of is women produce a hormone called relaxin, which is what helps us to relax our bones so that we do grow and be able to push baby out. So we try not to over over manipulate women, especially at different stages of pregnancy. But can they get adjusted? Yes. And if you ever meet a pregnant mom who's been adjusted, she is like, I swear by my chiropractor. For the relief that she's got babies sitting in her pelvis for months, just growing. It's hard on the body. So to do certain things during pregnancy is really special. I was adjusted during my second pregnancy, and I don't ever plan on having any more kids, but if I did, I'm a huge advocate for it. And I highly suggest women to see a chiropractor while they're pregnant. It's very helpful. Yep.
Wow. I'm like, this could have saved me all the ear infections I've had when I had as a kid, and then as a grown adult needing to go get tubes put in my ears.
I had them also. I also had tubes in my ears, and it caused issues. I wish I had known then. I did not grow up with chiropractic care. So there's a lot of misinformation out there about what we do or what we can do versus who we are. A lot of us, we're often not the go-to, and inherently we want to be preventative. We don't want to be reactive, right? We want you to see us as like you would if you went for a dentist and get an oral cleaning to prevent the cavities. Chiropractic care is meant to be preventative. And so a lot of times when we see people, especially as we get older, they miss out on all these years. I say all the time, I wish I could have had you 10 or 15 years ago. This would have been so different, but unfortunately that's not the case. So we do what we can with what we have, but it's amazing. It's pretty cool.
Well, what is the difference? Because I've heard of, and I'm trying to make sure I'm saying it right. The spinal network adjustment, is that the same? It's not the same thing, but it's similar to chiropractic care.
Yeah, so something like spinal network is a little bit more of tonal. Everyone has, that's the artistry, right? So we're built off 3 pillars: science, philosophy, and art. The art of chiropractic is going to vary depending on who you see. I am a full spine diversified. I do Thompson, Toggle, a little bit of Gonstead, a little bit of activator. I'm a mixer. Some people just do spinal network, which is a little bit more tonal, and it doesn't require or doesn't involve the osseous adjustments and the pops and the cracks that you hear. So it doesn't mean that it's not chiropractic care. Again, chiropractic means done by hand, right? So it is not the adjustment that is chiropractic. It is what we do with our hands to clear the nervous system that is chiropractic care. And that can look different and will look different amongst different providers. So I don't do network spinal. It's not my flow. There's nothing wrong with it. I love an osseous adjustment. I don't live for the crack, but it's weird out. And most of my patients are like, yeah, that's it. That's the one. So we all have our thing that we love, right? And that we do. So, but network spinal, it's a really good technique as well. Some people really like that because they want to get a clear system, but they don't want the powerful adjustment that comes with it. And you don't have to have that. It's really amazing what you can do and how you can talk to the body with touch.
Yeah, because that's so transparency. That's what I do. Mine is the spinal network adjustment or analysis, whatever it's called. But that's what I go to because I was terrified of, having them do popping and cracking and stuff. And so for me, it's been, and then I had to feel like I trusted her. I was like, let's start with this first before we graduate to anything else. But she's adjusted my knees, my ankle. If I go in and I'm like, my wrist hurts today, it's like she can adjust it. Well, she uses like an instrument for those things.
The little clicker.
Yeah, because it sounds worse than it is, y'all. It doesn't hurt that bad.
It doesn't. And if it hurts, it's not right. So
right, yeah. You guys, we have like about 10 more minutes, so make sure you get your questions in. I do see Lynette McCallum has a question. She wants to know, what quality should you look for when selecting a chiropractor?
That's a great question. I think that you should find someone that you personally connect with. It should feel natural. A lot of times our patients tend to become like family to us. We get so deep and personal in their lives. So interview your chiropractor. It doesn't have to be where you go and if you're not comfortable with them, you're not going to be able to relax on the table. That's hands down.
Mm-hmm.
So you need to be able to be comfortable so that you can trust your doctor. They all have different techniques. So I would say read about them. You can call and ask questions, and you can go in for a first visit. Sometimes doctors will do a consultation with you, and just kind of walk you through what it is that they do. And you might find that this person, I really either click with them or I don't, or I'm looking for something different. There is a community that we have on Facebook. We have different organizations where we list different like Black doctors. If you're looking for a specific nationality, we can help you find those as well. And a lot of us are, we're not very competitive amongst each other. We want our patients to find the doctor that is for them. So if someone comes to me and they're looking for something specific, I've had friends from high school who are like, this is what I do and this is what I'm looking for. And I have paired them with different, providers around the city. I don't care that they're not seeing me. That doesn't matter. I want them to be under care. So it should feel natural. We are a very like loving community as is. So if you don't feel loved, I would almost tell you that that's probably not the place for you. Shamika could tell you because with your doc, like you feel like she knows your life and she knows your body. And that's what you want. You want someone who is going to tune in and like really try to connect with you like that. So
yeah, I think I described it last night when I was telling someone. I was like, it's like when I go in there, it's like a warm hug.
Yeah, that's exactly. First of all, we're all huggers, so we like love to hug people. That's number one, and you have to like, okay, be okay with getting a hug. But it should feel like that, honestly. Like chiropractic care should feel like a warm hug. It should feel like you've been rocked to sleep like a baby, and you're like, oh, thank you so much. This is great. Like that's how you should feel when you walk out of your office. That's what we want, at least.
Yeah. So even with I want to go back to the mental health and emotional kind of aspect of the nervous system. I'm trying to think because this wasn't one of my original questions. So I'm trying to think how to word this because I'm just curious so for example, we'll just use this as an example. If you tend to have negative thoughts, negative self-talk, is there like a bone in your neck, body, spine, something in your spine that dictates that? And is that something like it could help make things more positive in your brain, make you kind of more open to life? You know what I mean? I don't know if I'm explaining it right, but.
So what I see as it relates, when I have a lot of friends who work on positive psychology, so they've gotten their master's in positive psychology alongside of getting their degree in chiropractic care. I have some colleagues who specifically do neuro-emotional technique, NET work, where it helps to clear the subluxations because what causes our body is a physical manifestation of what we think, right?
Yeah.
So if there's something happening here and you're telling yourself, I'm okay, eventually your body is going to show that you are not okay, right? You're going to have that tension in your shoulders, your hips start to hurt, low back pain, whatever that is. It looks different for every single person, but our body is a physical manifestation of what we think, period. So when we look at patients who have some mental health issues going on, we tend to see that they've been living in a state of chronic pain and normalizing it. And they're like, it's fine. I have this thing. It just won't go away. It's not. I had a kid. One of my students told me that today. I'm like, no, we're not going to normalize pain. We're going to correct it and get rid of it and try to minimize it as much as we possibly can. But if you are walking around discomfort every single day, can you imagine what that's doing to your mental health? Vice versa, if you have mental health issues going on and you're in chronic stress all the time, it's physically going to have an impact. So the two can go hand in hand, right? Where we could clear something. I've had people, I've adjusted them and their response is either laughing or they're like, oh, and I've had cries. The cries are always like the ones that I'm like, wow. And we take a second, we pause right there. Because I might clear something in their wherever. I don't know. It's different for every single person. And their autonomic response is tears. They need to let it go, they're able to finally release the thing that's been holding them back. And I'm not a therapist, so I don't dig into what that is, but
Yeah.
I care about them. So I check in. Like,
Hmm.
"Hey, are you good? Like, what's going on?" And then they tend to tell me what's happening, right?
Yeah.
Then I'll recommend, okay, I want you to see a colleague of mine who either does this, or maybe we get you over someone who does mental health therapy.
Hmm.
So there is a direct connection to mental health and what happens in our spinal system anywhere in our body. Nervous system holds emotion. We have parasympathetics and sympathetics. A
Hmm.
lot of us in America, due to the state of our society, are walking around in fight or flight. We are constantly, there's a fire alarm going off in our head every
Hmm.
single day, and we are running, 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 trying to figure out how to just be okay on a day to day basis.
Hmm.
Our job is to take you out of that and put you back in rest and digest.
Hmm.
Let the parasympathetics work, relax the mind, relax the body so that you can finally heal and get well. You cannot heal, you
Hmm.
cannot get well when the fire alarm is constantly going off in your head.
Hmm.
So it's really cool, and it's special, to be able to help someone through those kind of moments. And we
Hmm.
have them. I have them. No, I mean, we're human.
Hmm.
How often we address them is what's important. And a lot of times we just don't address them enough. We, especially in our society as African American individuals, Black and brown people, we normalize the things we go through, and we
Hmm.
deal with it and we push through it. It does not mean that we are handling it well, though. And our body is going to tell us that every single time. So,
Yeah.
yeah.
Yeah. My chiropractor, she said, I think it was a couple weeks ago, I was like just so stressed out, mad about everything. She said, "Oh, I see we need an attitude adjustment today." I was like, please.
Yeah.
She got
Yeah.
me together. So
Yeah.
we got a few more questions in the chat. Let's see. Berta McCallum wants to know, what degree do chiropractors need?
To get into school or once you
Yeah.
graduate?
I'm guessing to graduate or to practice.
Okay, so I mean, you have to go to an accredited school, get a degree as a chiropractor. It's a doctorate degree. Most programs are anywhere between 3.5 to 5.5 years, depending on how many credit hours you take. But we do hold a federally licensed doctor. I wouldn't say it's doctorate because that's a PhD, but a doctor of chiropractic. So we
Mhm.
do not hold a medical degree. The reason we don't hold a medical degree is because we don't do medicine. We
Mhm.
don't do drugs or surgery, which requires medicine, so we don't hold a medical degree. The majority of us don't want a medical degree. We
Mhm.
like to do things without drugs or surgery. So our doctorate degree is in doctorate of chiropractic.
Okay. Let's see. We've got Robert Brooks the second. He says he had a motorcycle accident, 11 broken ribs. Wow. But they've healed in a broken formation and he still has pain. Could chiropractic care help with that?
So it's one of those things where once something has been damaged, you can't undamage the damage, right?
Mhm.
If they've healed and they've healed in that manner, that's how they've set and how they've healed. What we tend to work on with patients that have kind of injuries like that is the soft tissue that supports and surrounds it. So a lot of times it's soft tissue work that we tend to do, which goes alongside of chiropractic care. It's not always about popping bones. It's not
Mhm.
always snap, crackle, pop. A lot of us do soft tissue work as well. And so for those kind of instances, we would start addressing what is going on with the soft tissue around it. Are there areas that we can strengthen? Are there trigger points that we can release? Is there scar tissue that we could break up? What happened post the accident? We can't refix the bone because that would be an orthopedic surgeon, but we could co-manage with them and then add the PT in there. So yes, could it help? Absolutely, but not every chiro does soft tissue work. So that's one of those things where you kind of have to do that interview with a
Mhm.
chiropractor and ask them, hey, do you do soft tissue work? I love it, and I do it with most of my patients because they need it. But not everyone does that. So I don't want to say that that's a norm across the field, but more often than not, you will see that either in some form of cupping or Graston or trigger
Mhm.
point therapy. So it could help. Absolutely.
Okay. Let's see, we kind of touched on this earlier, but this question from Linda Young, my mother, she's asking, will having migraines benefit from seeing a chiropractor? Look at my supportive parents today.
Yeah, I bet you my mom's probably on here too. Okay, can you say her question one more time?
Oh, she was asking about if what, let's see, it scrolled up on me. Hold on. Will having migraines benefit from seeing a chiropractor?
Will it help? Will
Will
chiropractic?
it help with it? Yeah.
Yeah, so it depends on what causes the migraine, right? If it's stress related, if it's hormonal, different things like that. Now, if it's musculoskeletal related, which oftentimes it can be, then yes, we can definitely. I have patients who have chronic migraines, and we work on them weekly. We do small, little light force adjustments in the cervical spine. Again, back to the soft tissue work. I love working soft tissue in the neck. There are a ton of muscles that connect our neck to our head that we don't
Mhm.
think about, and even in the back of our occiput, which is the base of our skull. And so I'm all in my patients like head, and we're working on the back of their necks and taking the tension out behind their ears. Sometimes we need to look at their jaw and that
Mhm.
TMJ. I want to see what's happening in this joint to see if that's causing some of these issues as well. So again, it can. I highly recommend if you're having the one that has migraines, that's a very specific question that I would ask a chiropractor that you want to see. Hey, what is your success with migraines? Or do you treat migraines? Or do you work with patients who have chronic migraines? Because we tend to do a little, like, again,
Mhm.
our artistry. And so for me, I don't shy away from migraine patients. I love them.
Mhm.
But I have very specific, there's moves that I know how to do, or techniques that really focus on or can kind of help clear some of those things in that area. Um, but yeah, migraines is one of the things that walks into most of our offices. I would
Mhm.
say second to low back pain. So we do really well with them.
Actually, that was the next question. So, Marsha Jones, I don't want to mess up your last name, Marsha, so I'm not even
It's
going to try it.
Shari.
Okay. Okay. So you know who it is. Is that your mother?
No, that's not my mom, but she's like my mom. She's
Oh,
fine.
okay. She was asking what is the most common reason someone would schedule an appointment. So that
Yeah.
kind of went right perfectly into that question.
Yeah, so obviously we see, patients that come in with any type of back pain, right? So that's usually the most common reason. Usually second is migraines. Then the second thing that I see is numbness or tingling, sciatic nerve issues where they are
Mhm.
like, I've had this thing and it's driving me crazy. I love sciatic patients. They think it's that we can't get rid of it. We can get rid of it. It's really fun. It just takes a lot of work. I also want to say the one thing that I did not say earlier is I think I said this, but I want to reiterate. Our job is to remove the interference in the spine. The
Mhm.
second part of chiropractic care is what you do at home, the lifestyle changes that you do to work alongside the things that we do to clear the interference. So if
Mhm.
you are not, I've told patients, I have not taken people on as patients because they don't want to do the work.
Mhm.
We're not going to fix everything in one or two visits, but you have to go home and do the home exercises, do the
Yeah.
therapies, change your diet, switch what you're eating, add in some exercises, core stability.
Mhm.
A lot of times in our society, we want a quick fix. And chiropractic is not about a quick fix. It's about
Mhm.
clearing it so that you can help your body fix itself well.
Mhm.
So I know that was kind of a two-part response, Aunt Marcia, but that's I mean that's the those are the things that we see often, and then we challenge our patients to take the therapies and continue doing them at home, and then when they come back the next visit, there should be some progression.
Well, I'm glad you answered that because I was going to try to squeeze that in. I know we're a little over time, so so I'm glad you answered that question. I did want to ask one more quick question about, well, like what? Because my chiropractor is always like, "Here's your homework for today,"
Mhm.
but but how long does like the chiropractic care usually last for a patient? Like whatever they're coming in for. Like I've said, I've been going since July, and I was going at once a week, and now I'm twice a month. And
Yeah,
now we're going to eventually go down to once a month
yeah.
just for kind of like that maintenance.
Okay, so great question. A lot of times people think that once you start getting adjusted or see a chiropractor, you have to see them for life. That's not true.
Yeah.
You tend to want to see a chiropractor for life. When I teach you as you're experiencing what normal feels like and you
Mhm.
learn a new normal, you are able to more quickly identify when something's wrong. And
Mhm.
so then you're like, oh, it's time for me to go see my chiropractor. I
Yeah.
have this thing and it's out, and I can tell that it's now time.
Mhm.
Every protocol is a little different. I would say the standard is 2 to 3 times a week for the first 2 to 3 weeks, because we
Mhm.
want to try to affect and make a change quickly so that you can experience it and get some rest from
Mhm.
whatever's bothering you. And then we're going to slowly back that down over the course of a few weeks. So anywhere by 6 weeks, I should know if we've made a nice change. Sometimes 4. By 8 weeks, we should be redirecting the plan to get you to phase 2 of whatever that is, whether it's stretching or strength training or anything like that. By 12 weeks, we should have made a significant change in whatever
Yeah.
your condition. And after that, then we can kind of
Mhm.
divide plan is, or take you to the next level of whatever that is. And so then it becomes where we move from acute care into this maintenance care. I always tell my patients, I'd love to see you. I don't want to have to see you. I love seeing you. I don't want to see.
Yeah.
I don't want you to want to have to see me. I want you to want to see me. Right. So come
Mhm.
in, need to, not because you have to. Same thing with the dentist. Your dentist does not want to see you to fix your cavity. They want you to come
Mhm.
in for cleaning and maintenance twice a year so that they don't have to do your cavity fix. We're kind of the same way, so to speak. So we want to see you and keep you well, keep you clear. We don't want to always have to be chasing something. And that's just it's hard on you, and it can get expensive and costly. So
Yeah.
again, a lot of patients tend to become lifetime patients. My oldest patient was 101 and had been getting care since he was like
Wow.
10 or 12 years old. Yes. And we were still adjusting him, and he is still alive. He's probably like 103 now. I'm not at the office anymore, but
Mhm.
yeah. And he's like, once I started, I never wanted to stop because I understood the benefits of chiropractic
Mhm.
care. It's maintenance. It is
Yeah.
truly just maintenance. So, yep, once
Mhm.
you start,
Yeah.
it's not about stopping. It's just about keeping the system functioning. We age, our body is constantly changing. Who I am
Mhm.
today will not be who my body is in 5 years from now. And having someone that can constantly keep up with that over the course of my lifetime it's amazing. It's great. So,
Mhm.
so
Yeah.
I patients to give it some time. Don't think that one visit is going to fix it. Give your
Mhm.
If you're new to it, allow your doctor at least 4 to 6 weeks to work on an issue, and then make your decision based off of that.
Okay.
Yeah.
Are you good on time? Because we've got a couple more questions in the chat.
Oh,
Like, people have a lot of questions for you. And it's funny how you actually mentioned the part about feeling normal. I remember the third adjustment. I told her, I was like, I don't think I can see, and she was like, no, maybe you're actually seeing for the first time, because it was just like everything just cleared up, and I was like, no, I think something's wrong. And she's like, no, it's like, she's like, sit there a minute, and then I'll come back. And when she came back, I was like, okay, maybe it's just like it was like I was seeing things like new. Like, it was like it wasn't didn't feel all muddled. I don't know how to explain it, but it
we
was like,
call, we call that the lights on moment, or the
yeah, that's what it was. It literally was.
like you're like your pupils dilate. So we have doctors that track specifically the nervous system changes. We call it, they're functional neurologists.
Mhm.
They're very cool chiropractors. They do a lot of eye work and brain exercises and training. They track some of those neurological changes that happen in the moment. But we call that's the lights on moment, where you have a neurological reset and you're
Mhm.
like, whoa,
Yeah.
what was that? Oh, and I mean, I'm literally getting chills just talking about it, because I know what that moment feels like.
Yeah.
So cool when it happens. It doesn't happen every visit, but when
No.
you get that powerful neurological reset like that, it's like, oh my gosh, what?
Yeah, it scared me because I was like, oh gosh, did she mess something up? But it was like, wait, no, I feel good.
Yeah, it's a reset. Yeah, most of us have never had our nervous system reset ever, So I love that you had that moment. That's awesome.
Yeah. Let's see. We've got Helga Bowden. I'm not sure if I'm saying your name. I'm sorry, y'all, co-host, if I'm messing y'all's names up. But she says, as a cosmetologist, many stylists and barbers develop carpal tunnel by, and so they've developed it by going to a chiropractor. Is there, oh, she's saying they develop it. And so would a chiropractor help reverse it?
Yeah, so carpal tunnel can be caused by a couple of different things. So the carpal tunnel runs in between our hands, right? It is
Mhm.
literally a tunnel right here with a little tendon sheath, and that is the actual tunnel. It
Mhm.
causes hand pain and tightening. You can have that trigger finger. And so a lot of times what orthopedic surgeons will do, they'll go in and they cut the sheath that covers the carpal tunnel. But that's typically not the issue in someone like Helga, because she is constantly using her arms and her wrist,
Mhm.
elbow, and her shoulder. So what I do with patients before we send them to ortho and have them have surgery, we clear every area that that nerve can be pinched. Cervical spine, shoulder, because our thoracic outlet is through this region. All of our
Mhm.
nerves run down through this. So we clear the shoulder, we clear the elbow, and then we clear the wrist. And we do that a couple weeks at a time to see if it makes changes. Are there patients who need surgery? Sure. I can't say this 100% where everyone who has carpal tunnel issues is not or is a candidate for surgery, but I
Mhm.
always highly suggest getting everything cleared out first, giving it time to see if that makes changes before resulting to surgery. So we can't undo surgery. You go in and
Mhm.
take something away or you cut something, we cannot put it, but we don't have the technology. This is not Wakanda yet. So we don't have the ability to put something back once we
Mhm.
take it out or once we remove it. So I
Mhm.
always suggest to patients before you go in for a surgical, you can go in for the surgical consult, but before you go under the knife, do yourself a favor and give chiropractic a try. It could be the thing that makes a difference.
Mhm.
Yeah.
Okay. Okay. Let's see. We've got Patsy Graham Walton. She says after her neck injury resulted in a spinal infusion, her neck and shoulder is constantly stiff. But she saw a chiropractor for a year, but she still has stiffness.
Yeah.
So should she probably, I guess, continue going to the chiropractor, or what would be your advice for that?
Had a spinal fusion without getting into her history of not
Mhm.
knowing exactly what type of surgery she's had. So if she's had a fusion, she may have some hardware in there. So we can't adjust through hardware. We can only adjust through bone. If there are things in there like hardware, well, you need to consider that muscles have something that they have to attach to. Now we have taken out the structures, or we have changed God's design on the structures. And now these muscles either don't have the correct attachment points or they have rerotted themselves to attach somewhere else to aim,
Mhm.
right? They've got a foreign body in there. You're going to have chronic tightness. That is where the muscle work and the soft tissue therapies come into play. So we get in there a lot of times. I have patients who've got, let's say, if they've had disectomies or they've had fusions in their low back. I can't adjust through hardware. I will never try to with a tool or a hand. It's just not possible. But I
Mhm.
will go in with my Graston tool and muscle scrape and take the tension out of the muscles that are directly surrounding the hardware. So those are things that can help. Things that would help her would be, stretching, home therapy exercises,
Mhm.
different things like that. So she needs a little bit more of a catered plan. But are we going to be able to adjust that region? No, we can adjust above it and below it, but not through it, because
Okay.
the structure has been changed. Mhm.
Okay. Um, I think I got everybody's questions. I think so. Of course, if someone is on the fence about seeing a chiropractor, what would you say to encourage them? Because I think you've said a lot of things to encourage them. If I weren't going, I would go.
Yeah. So, chiropractic is inherently safe, right? There are different ways that you can get adjusted. If it is the pop or the crack that you're concerned about, you don't have to get that. Like Shamika was explaining to you, that's not the type of chiropractic care she gets. And so, there are different doctors for different people. That's a beautiful thing about our artistry. You can do something like an activator technique or a toggle that does not require that snap, crackle, pop sound if that's where your apprehension is.
Mhm.
I always say listen to your innate sense of self. If you go in and something doesn't feel right, then something's not right. Then that's at any doctor. I don't care if it's a
Mhm.
medical doctor, a dentist, or a chiropractor.
Mhm.
Um, but you don't have much to lose if you are not a good candidate or there are contraindications for you to get adjusted. a chiropractor would be honest with you and should tell you that. If there's questions, we have, like I said, resources. Most of us are really good at trying to pair people up with people or doctors in their area. We tend to send to our colleagues and things like that. So you don't have a lot to lose. In terms of the safetiness of it, I want to say that, I drive a luxury SUV. My car insurance is more expensive than my malpractice.
Wow.
So my car insurance feels like I am more likely to get into a car accident than my malpractice feels like I am more likely to hurt somebody. So that should kind of give you an idea of the safetiness of chiropractic care. But everyone, you have to try it and you have to give it time. It's not a one and done. It does take time. We're not going to, some people go in and have a great experience first day and it's like, wow, okay. And some people it takes a little bit of time, but for the most part, most people you don't have anything to lose by at least visiting one for, and check it out for yourself. We all have something different. Yeah.
Yeah. Well, I always ask my guests what feeds your soul. So what feeds your soul? I think I can guess, but what feeds your soul?
It's crazy. Like I'm actually a little bit, I think, addicted to helping people feel better, like heal better. I love that. Personally, I have my kids and I love that. I'm now on campus in a teaching capacity and being able to pour back into students and like see their eyes light up and they have that aha moment. That's extremely exciting for me. Watching my kids grow up as chiro kids and seeing how well they thrive under chiropractic care. My 4-year-old tells me when he needs to get adjusted. Like, I'm not even lying. He's like,
oh, wow.
Mom, like, oh, my neck, my this, I need to get adjusted. And I think that's the cutest thing ever because he only knows life under chiropractic care. So it's cute because he just realized maybe like, I don't know, 6 months ago that mommy's actually a doctor. He was like, you're a mommy. And I'm like, no, I'm a doctor too. He gets it. So that's super exciting for me. And then my patients, having the ability to spread the message of chiropractic care, to educate people, to dispel any myths or untruths about chiropractic. That is a hill I am willing to die on all day, every single day. My family tells me, they're like, yeah, you're probably going to be a chiropractic politician because I believe so much in what we do that I'm willing to fight for it because we're just uneducated about it. And there's so many things that we could benefit from. And it's life-changing. And I'll just leave you with this. I have, in 4 years, have caught cancer to some degree in like 4 or 5 people. These are people who go to the doctor. But guess what they walked in with? Low back pain. They walked in with neck pain. They walked in with arm pain. And we did our due diligence and they had some form of cancer. Now, it's not my job to tell them that they have cancer. I refer them out. But I knew they had it. I knew it. And those are the moments that I live for. So no, I'm not a 911 going to save your life doctor, but I can tell you stories, so many where I have seen chiropractic change people's lives that thought they had no hope. I have people who have been on my table that were suicidal because of chronic pain and they were able to finally get some relief. That's the best feeling ever. I just want people to know that they have an option and they don't have to rely on drugs and surgeries to numb or mask things. It's time to like fix it and clear it. And that for me is that feeds my soul. I just want people to smile more. And people are walking around so pissed off because they're in pain every day. And that sucks. They don't have to do that. They have other options. So I will always be an advocate for what we do, from cradle to the grave. And we are literally womb to tomb. Totally. I don't care if you're dying. Like one of my mentors on his deathbed got adjusted. And on his deathbed. So incredibly special to hear that story and to know that his family full of chiropractors, literally while he was dying, they still went in and cleared his nervous system to make
Dang
sure.
it, I feel like I'm about to cry. That's like, I can feel the tears. I was like, oh gosh, no, not right now. Don't.
Yeah, it's that powerful and it's so special. And if I could give it to everyone, I would, but I can't because people have to make their own choices. So that's why I do these things with you. And and other social media platforms. I just want people to give themselves an opportunity to heal better. And that's it.
I love that. I love that. Well, I want to thank you so much for coming and sharing all about chiropractic care, because there's so many misconceptions out there, and
Mhm.
hopefully you cleared that up for everyone. And of course, you can still ask Dr. Jackson questions, because she's going to tell where her social media is so you guys can find her.
Yeah, so you can find me on Instagram at my Instagram is Dr. Heal Better. I'm also on Threads, which is how we met, which is amazing. So same thing at Dr. Heal Better. My website is healbetterchiro.com, so you can send me messages there. Or if you have a direct question and you just want to email me, you can email me at healbetter@dramberjackson.com, and I will try to get back to you as quickly as possible. I am a one-woman show running a lot of things, but I promise you I will try to respond to everyone's questions. Or if you have anything, consultations, I just want you to know that you have options, and you don't have to live in chronic pain. So let
Awesome.
me know.
Yeah, yeah. And I see everybody in the chat is grateful for this conversation. It looks like we fed their souls tonight. So I'm
Oh,
grateful
really?
for that always.
This is
Yes.
very special. Thank you so much for the opportunity.
No, thank you. Thank you. So you definitely have to come back soon, because this was
Uh,
great. I didn't even get to all the questions I sent you.
Part two, right? We can
Yeah,
get
part two. So
part
for
two.
more information about chiropractic care, we have some articles on blackdoctor.org that you can go check out. And I'll be back next week, you guys, on Wednesday. So I want you all to have a soul-filled rest of the week and weekend. And keep commenting, because I come back and check to see what y'all are talking about. So and again, make sure you check out Dr. Amber Jackson. So I will see you guys next week. Bye.